In this video, we will go over an insurance verification that is for when a patient has Medicare as primary and commercial insurance as secondary. So these insurance verifications are tricky. These are difficult types of billing setups to know right up front the exact amount the patient is going to have due, but it does give you a general guideline and the patient a general guideline up front. So it explains that the patient has Medicare as primary and commercial insurance as secondary. So first we show the Medicare benefits, and then we show the commercial insurance benefits, and then we show how the commercial insurance will coordinate with Medicare. Again, there are no guarantees up front, but it gives a general idea. So for Medicare as primary, for this section, it shows your clinic's participation status. It shows the amount of Medicare deductible for this year and how much is left to meet. So this patient has still the full $198 Medicare deductible to meet for this year. With Medicare, the copay or coinsurance amount for a 98941 spinal manipulation is between $7.60 to $8.30, depending on which year it is and which doctor is treating the patient. Exams and re-exams are not covered by Medicare. They are recommended to do on the first visit of a new diagnosis, and they are patient responsibility. X-rays are not covered by Medicare. They are patient responsibility with Medicare. Therapies, the same, not covered by Medicare, patient responsibility. Chiropractic maximum, as we always say, there is no chiropractic maximum with Medicare for chiropractic, but it does have to be medically necessary, and it is very possible that Medicare would do a records review if the care goes on too long. Pre-authorization is not required for chiropractic with Medicare. Next to the commercial insurance that is secondary. In this example, the patient has a Blue Cross Blue Shield commercial insurance plan and the clinic is in-network. So the in-network benefits for this plan are as follows. The patient has a $250 individual deductible with Blue Cross and still has $200 left to meet of that individual deductible, and the deductible runs on a calendar year. There is no applicable family deductibles, so nothing is listed there. After the deductible with this insurance, the benefits are the same for spinal manipulations, exams, x-rays, and therapies. And it is a coinsurance amount that the patient must pay per visit. It is a percentage of the allowed in-network rate since the clinic is in-network with this insurance, and it is 30%. With this Blue Cross commercial plan, there is no chiropractic maximum and pre-authorization is not required. So let's talk about the coordination of benefits between the two insurances. And again, this part is tricky. I always say to clinics that basically you give general guidelines to this type of patient and explain that the coordination between the two insurances is not always exact. They do not let us know upfront exactly what they're going to cover or not, but we do the best that we can on the verifications to find out how the two insurances will coordinate. Will the commercial insurance cover the Medicare deductible? And in this situation, we put no, because if the care goes to the patient's Medicare deductible, which is $198, the secondary is not going to cover it because the patient still owes $200 for that deductible. So it's going to go to both deductibles. Now, again, we say that as of the date that we did this verification, but there are so many variables. You know, the patient may go to their primary care physician tomorrow and get $500 worth of treatment there and eat up both of the deductibles of both places. But as of this day, this is what two insurances verified. Next question, will the commercial insurance cover the Medicare coinsurance for spinal manipulations? No, because the Medicare coinsurance amount is that between $7 and $8 basically, and that is a 20% coinsurance. Well, the secondary has a 30% coinsurance. So no, it's not going to cover the Medicare copay amount. So basically, the patient for a spinal manipulation needs to pay between $7 and $8 or such. So since we said no, it explains that they need to pay that spinal manipulation coinsurance / copay amount. Will the commercial insurance cover exams or re-exams that Medicare will not cover? Yes, they will, because Medicare does not allow exams, x-rays, or therapies, but commercial insurance normally does. So for this, see the amount that the commercial insurance will pay for exams. Let's go back, and we see that it's 30% of the allowed in-network rate. So if the patient has met the deductible with the commercial insurance, then they are going to pay 30% of the allowed amount for any exams, re-exams, x-rays, or therapies. Clear as mud, right? So that is the general explanation of the coordination between these two types of insurances when a patient has Medicare as primary and commercial insurance as secondary.